So we've been seeing the lawmaking for the medication disposal is trending toward more end user disposal regulations and options. There's a plethora of unused and unwanted medication from end users that needs to have proper disposing. They're trying to dissuade people from, throwing it in the trash or flushing it into the sewer system. And drug abuse and environmental concerns are prompting alternative disposal methods. It's just a huge issue right now. One such disposal method that more and more states are regulating are mailback programs. And federal law allows this, and they allow the states, tribal law, local law enforcement, or collectors to run mailback programs. And also some states are using mailback programs in the form of envelopes or packages to help the end users dispose of their unwanted medications properly. And many of them will actually give them these when they give them their prescription, just so it's easier and more convenient for them. A California regulation allows pharmacies to provide pre-addressed mailing envelopes or packages. It allows consumers to return the prescription drugs to an authorized DEA destruction location. What I'm noticing is that every state has a different place that they have to return the drugs, and it varies by state. Ohio also allows authorized collectors, and they can operate a mailback program, but they can't accept or use needles or Schedule I controlled substances. So there are some limits that will be specific to the state as well. In Georgia, authorized collectors provide prepaid mailback packages as well to patients and their families. Also, though, Georgia stipulates that collectors that are pharmacies can't receive or dispose of the mailback packages. They have to be shipped directly to a licensed reverse distributor for disposal. So some have DEA locations, some send to distributors, etc. So all of those will vary by state, but it's becoming more and more popular to offer the mailback packages or envelopes. Another method of disposal that seems to be a little newer that we're seeing more on is the alteration of the controlled substances. This is interesting because it can happen at the pharmacy collection site, or some are actually providing in-home solutions that alter the drugs and make them inert or unusable. The process alters the characteristics of the drugs, and they can't be transformed to a physical or chemical condition where they're a controlled substance or a controlled substance analog. In Missouri, they actually specify that medication that's collected has to be rendered, their word is non-retrievable. And per them, it means it's permanently altered, so it's unavailable and unusable for practical purposes. They don't want people to be able to change it into something else, to use it as a precursor or an analog. There's a new law in New Jersey, they've titled Charlie's Law, and it was effective in April. And it's about the safe disposal of controlled substances and used needles. And it establishes that when a pharmacy dispenses a controlled substance or syringes are sold, they're actually going to provide written materials on safe disposal, and they have to offer at least one way, whether it's for free or for sale, on how people can dispose of those needles and drugs. And it also may be as simple as giving them information on secured medication kiosks or boxes. The secured boxes or kiosks have to follow DEA requirements for pharmaceuticals that are collected, and they have to be signed and marked properly so people know exactly what they're for. That Charlie's Law was effective in April. Also becoming more popular are the take-back events for medication disposal and the use of collection receptacles. They are authorized by federal law as well. And each take-back event has to have just at least one collection receptacle for the collection of the used controlled substances. Also, law enforcement, and you may have seen this in your states, law enforcement is specifically authorized to conduct these take-back events. And it's very popular for the city police, local police to run this take-back event for the city. In South Carolina, a statute there allows retail pharmacies to apply to be a registered collector by the DEA. So that's an instance where you have to alter your registration. You have to apply to the DEA in order to be an authorized collector. and they actually are allowed to receive Schedule 2 through 5 controlled substances, not Schedule 1. Their collections can happen through law enforcement, take-back events, or they also have mailback programs. So it kind of combines a mailback event. Their Department of Health and Environmental Control is responsible for their guidance and regarding collector registration and participation. So each state has something a little bit different. In California, their pharmacies are allowed to offer take-back services. It's in the form of collection receptacles in their facilities, actually. But their pharmacies are expected to follow your federal, state, and local requirements. And then they also have registration with the DEA as an authorized collector required, as well as their normal licensing. So we have states that you have to get a DEA authorization to be a collector as well. Ohio also authorizes allows authorized collectors per one of their regulations, and they can operate a drug collection receptacle. Theirs is interesting in that their collectors can't operate take-back events, though, but they can collect non-controlled substances too if they're authorized, but they have to follow federal guidelines for that. So that's a little bit different. It isn't just controlled substances. That regulation allows non-controlled substances as well. One thing they specify is their collector can't dispose of any of their own inventory or stock of controlled substances, dangerous drugs, or over-the-counter meds in their own drug collection receptacles or through mailback. And then we also have Virginia regulations. These are more, this is about collection receptacles as well. They allow manufacturers, wholesale distributors, and reverse distributors to become authorized by the DEA. So that's a little bit different. So they're talking about the manufacturers and distributors as opposed to pharmacies. They can actually collect the unwanted controlled substances in collection receptacles or through mailback programs. So there are varying ways and people who can become authorized collectors depending on the states. Also in 2019, Oregon, while they don't have regulations in place that I've seen, they passed a bill that outlines plans for a program operator to run a drug take-back program. Key points that they are going to require in their plans are collection systems, disposal systems, mailback programs, and drop-off site requirements. So those are all key aspects when you're having a drug take-back program, whether it's mailback or collection events. Overall, many avenues exist for collection and disposal of the unwanted medications, including controlled substances. It's become such an issue that the states are now trying to provide more and more opportunities for consumers to get rid of their unwanted drugs. The public is being made more aware of the take-back events, collection days, and proper disposal. More states are instituting programs to make it easier and more convenient for consumers to properly dispose of their unwanted meds.